Okay, so this is your health reimbursement arrangement. It is electronically taken care of. Any claim that goes through the Anthem system and goes to your plan deductible or your plan coinsurance, actually for you it's the deductible only, gets fed over to Group Dynamics automatically, and then you get the check sent to you either in a paper check or direct deposit, depending upon how you set yourself up. So the PPO 1500, you have half of the deductible paid first, and then you are on the hook for the last half. And the same thing with the PPO 2500. You have half of the deductible paid first, and then you're on the hook for the second half. If you have a family, which would be you and a spouse, you and a child, or you and a spouse and children, you have half of the 3,000 or half of the 5,000. But remember that no one person can take all of that money. It has to be between at least two people. So if you're the only person who ends up sick or in the hospital or needing surgery, you are still going to be capped off at the $750 or the $1,250 as the individual. So any questions on your HRA? You should get a new one, which have the date of January 1, 2022 on there. And your HRA is going to continue exactly the same way as it has for this year. Your money will reset on January 1st, the same time my plans set on January 1st. There is ID cards. You are not getting new ID cards this year. Hallelujah. So your ID card that you have in your pocketbook or your wallet is still going to work. You will get a new ID card if you change plans, if you add a family member. The PPO plans, the preferred provider organization plans, those are the plans that technically through Anthem do not require a PCP, a primary care doctor. We've kind of forced you to choosing one. You've put it on your enrollment form, and it has been on your card going forward. As of January 1, 2022, the primary care doctor will no longer be appearing on a PPO card. Your card will still work. Your ID number is still going to work. Everything about your card is going to work. But if you were to call us after January 1st and say, I'm changing my PCP, I'm not going to have this doctor anymore, the service reps will tell you that we'll wipe out the PCP and we'll send you a new card, but we won't take your new primary care doctor's name because the new cards will not have a PCP on it. That should make life for you guys as the users of the plan a lot easier, because when a doctor's office, especially a specialist, sees a primary care doctor's name on the card, they immediately go into referral mode and they think you needed a referral to be seen there. The PPO plans do not require a referral. So by getting the PCP's name off of your card, it should eliminate them telling you you needed a referral, because now the PPO should be all they see, and they should know that PPO plans do not require referrals. If you would like a card that does not have your primary care on it, call the service reps after January 1st. We're pushing through the open enrollment changes first, and then we can take care of getting you a new card that won't have the PCP on it. If you're changing plans, it's automatically going to drop your PCP. And like I said, if you're adding a dependent, your dependent will not have a PCP. Janine, if you got the new enrollment form off my webpage, under that PCP column, it says now, do not fill this out if you are enrolling in a PPO plan. So we put it there, but we're not gonna use it if you happen to put your doctor's name in and we see that you're on a PPO plan. So any questions about that part of it? Nope. Okay, good. So like I said, your copays are not changing. The one thing that is going to carry forward in 2022 that is happening now in 21, telehealth visits for mental health and substance abuse providers. Right now, you are not paying a copay for only mental health and substance abuse via telehealth. And the Health Trust Board voted to continue that process all of 2022. So you will still not pay a copay if you are using telemedicine, but remember, it's only for the mental health and the substance abuse. If you are seeing a provider in the office, then you will have your $25 copay apply. Any other telehealth medicine, if it's a primary care or it's a specialist, those copays are not being waived. So it's strictly mental health and substance abuse that we're going to waive those copays for next year. So any questions about that? Because that's really all I had for medical. Like I said, there's no changes for next year. So your plan is your plan. And I see I've got a question here. Just one question. I have no children to cover, but I still pay family coverage. You have a spouse. Linda, you can unmute yourself. Yes, okay. So yes, the employee spouse and the full family premium is exactly the same. And that's on any medical plan that we offer. There's a big financial reason for that. It goes back 33 years as to why that is the case. But if we truly priced our plans the way they're supposed to be priced, the employee spouse would be the most expensive premium, and the family would be cheaper than an employee spouse. So technically, your tier is being subsidized by those that have 2, 3, 4, 5 kids to help keep your premium down. Because the health trust is old, everybody that was on with family when they lost their kids, they are still there working for us, but they're at an age where they're experiencing more medical costs than the full families are. So that is why we have to keep that premium the same. Anybody else have a question? All right. Life insurance. If you are enrolled in the medical plan, you already have a life insurance policy. It is at no cost to you if you're on the medical plan. It's valued at 1 times your annual salary, rounded up to the next 1,000. It's Janine's job and somebody at the HR department to let us know when your salary changes. You don't have to do anything for that. But the one job you do have is to make sure your beneficiary information is up to date. Some of you probably signed up a long time ago and you may have had family changes since then, gotten married, gotten divorced, had a kid, had a couple of kids. So if you don't know who your beneficiary is, you can update that anytime you want. We will accept the new form, override what we already had in the system, and put your new beneficiaries in place. That is the only job that you have when it comes to the life insurance policy. The other important thing that you should do is make sure that the booklet that we gave you, it's an 8.5 by 11, it's a dirty white color booklet, is somewhere in your important papers, because this is a term life policy. It doesn't do you any good as long as you are still alive. It pays out in the event of your death. When we get notified from York County Community Action that you have passed, we send a notification to a company called The Standard. That's who our insurance company is. They will send a letter to your beneficiary or beneficiaries telling them so-and-so has passed, you have been named as a beneficiary, and in order to claim your portion of the policy, you need to send back to us a certified death certificate. That letter does not say Maine Municipal Employees Health Trust. It doesn't say York County Community Action on there anywhere. It just comes from a company called The Standard. No better way for me to become you than to get my hands on your death certificate, because from there I can start researching all kinds of other things about you and basically become you online. So a lot of people will think it's a scam because there's nothing in your important papers saying this is legitimate policy. Please make sure that you have something, whether it be a copy of your beneficiary form or your booklet, to let somebody know that this is a legitimate policy. We, The Standard, is only going to reach out to your primaries 3 times. And if we don't get a response from your primaries after 3 tries, we'll move on to your contingents, assuming you named contingents. If you did not name contingents or your contingents don't get back to us, your life insurance policy becomes property of the state of Maine. And the state of Maine will publish that once a year in the newspaper for 10 years. And if it's unclaimed after 10 years, it truly becomes the state of Maine. So you don't want to give money away to the state. They take enough from you. Make sure you've got this information. If you need this document and you can write on the back who it was, we can get you this document. This document is available, I believe, on my webpage, but I can email that to Janine, just so you have something in your important papers that says, yes, I've got a life insurance policy and it is a valid policy.
This overview is available on our important documents folder, so electronically to everybody.
You have this one, Janine, the brand new one?
I do.
Good. Okay. The income protection benefit, that's our short-term disability. That is not in an open enrollment benefit. It never open enrolls. You only have the no questions asked when you were originally hired to sign up for one of the 3 levels of coverage. If you did not get in the benefit, or you went in on a low level and you want to increase it, you will have to go through what we call an evidence of insurability. You can be denied acceptance into the plan. This is a very, very tough plan to get in after the fact. If you're just trying to increase your coverage, you could be denied the increase, but we will not kick you off the level you're already on. So it's something that, again, if you want to take advantage of it, you should take advantage of it when you were initially offered. Otherwise, you do have to go through the evidence of insurability. This benefit is administered by Unum. So they are the ones who you'll be working with after you fill in your claim form and get approved in the system. Any questions about the income protection? Okie dokie. Dental. Dental is an open enrollment benefit. Dental had a 1% increase in premium this year. For the single person, it didn't even change a dollar. It didn't even equate to a dollar. The family went up to something for coverage for this year. But there are no benefit changes for 2022. So it is still Delta Dental, and your $12.50 per person annual benefit will reset on January 1st. Remember, the preventative and the diagnostic does not accumulate towards that $12.50. It's only the basic and the major that do. And if you are taking advantage of the Health Through Oral Wellness, the HOW program, and you have failed the assessment, so your grade was a 3, 4, or a 5, you get enhanced preventative benefits. You can get up to 4 cleanings per person per calendar year. We also add in fluoride treatment for adults. We'll extend the fluoride treatment for kids, extend the sealant treatment for kids, also do periodontal maintenance and tobacco cessation, nutritional counseling, etc. So all of these benefits get added to your preventative coverage if you have gone through the Health Through Oral Wellness assessment. You have to tell your dentist that you have this benefit. It does not appear on your ID card anywhere, and they will have no way of knowing that you have it unless you tell them. Every family member has to have their own assessment done. And again, they get that assessment right away. They're doing it online, live time, and it tells them the grade. If you are the 3, 4, or the 5, those benefits are added immediately to your profile. So any questions about the dental plan? So this is one of the open enrollment benefits, and if you're not making any changes, don't do anything. But if you want to make changes, now is the time to do so for the dental plan. And the vision. This is the one benefit that people will usually play with. I'm going to make this a little bigger because I don't want it to count as your eye exam. So we'll get that. Sure. There we go. Okay, so the vision plan is the exact opposite of the other benefits. It is not having a premium change for 2022. The rates are staying exactly the same for next year. However, it is getting benefit changes for next year. And as I said, the vision plan is the one benefit that people will play the game. They get in, they get out of, because you can only get frames every other calendar year. So if you got frames this year in 2021, you are not eligible for frames again until 23. If you got frames in 2020 or earlier, you are eligible for frames again in 2022. You can always get the lenses replaced because that's usually what changes is the prescription in the lens. Oh, and I went fuzzy again. Oh, Wait a minute, I'll get myself back. There we go. So it's the lenses that will change. And if you wear contacts, you can get contacts every year. But the frame piece is only every other year. So if you need to get back into the vision plan, that falls on you to make sure you are setting yourself up to get back into the vision plan. If you want to get out, that falls on you. You got to complete a form to get yourself out of the vision plan. If you want to add dependents, you can do so during this open enrollment. Also, remember, dental, vision, and medical are standalone benefits. You don't have to have the same people in all of the plans. If you're the only family member who wears glasses, only sign up for yourself for the vision plan. But if you're by yourself for medical and the whole family wears glasses, you can sign up for the family coverage under the vision plan. All of the plans for your dependent children is up to the 26th, end of the month of their 26th birthday. So they can stay on the plan. It doesn't have to be living at home, unmarried, going to school. They just need to be your kid and under the age of 26 to be on the plans. So what is changing for the vision plan for next year? The frame allowance is going up to $185. Frame allowance is currently at $155. So that is going up $30 next year. We're also bumping up Walmart and Sam's Club to the higher frame allowance. Right now, they are capped at the $80 frame allowance. Starting next year, you'll get up to the $185 frame allowance. The featured frame, so we don't have anything to do with that. This is a VSP thing. They pick the frames. I think they change quarterly, and they decide which frames are going to be their featured frames. It's up to the individual vendors to determine if they want to put all of them in. Maybe they don't carry all of the featured frames. So each vendor will tell you what their featured frame is from the smorgasbord they get to pick from, but not all of them participate in that. But if you do have a vendor that offers the featured frame and you choose one of the featured frame, your allowance is going to go up to $235. Right now, that's only at $175. So it's going up to a $50 add-on for the featured frame. Anything above the cost of $185 or the $235 will be discounted 20%. So the meetings I've been doing the past couple of weeks, people are telling me, yeah, I got frames for free. It didn't cost me anything. Well, they probably were getting them under the $155 or the $175. So with the new added allowances, that should bump even more of you to getting your frames technically at no cost or a minimal expense out of your pocket. Costco's, which we don't have any in Maine, but you guys are close enough to Massachusetts. If you want to drive down to Massachusetts to Costco, you'll get a $95 allowance at Costco. Currently, Costco is at the $80 as well. And then the other change for next year is going to be the contacts. Contacts are currently at $150 allowance. It's going up to $170 for 2022. So that should cover, again, a good chunk of your contacts, depending on whether you do the dailies, the weeklies, or the monthlies. And that $170 is at any place that you get your contacts from. They did partner, basically the pandemic forced them to, with an online company called Iconic, and you can get glasses and contacts through Iconic, and they are a VSP vendor, and they will put your benefits right through when they check you out, and you'll get all of your discounts, your bells, your whistles, your allowances, etc. with Iconic. And that that flyer is available as well. We got that for you. So if that did not, if you don't have this one, this is the flyer about how to use Iconic and how you get logged on with them. So they are the only.
This flyer is also available on our docs.
Perfect.
If anybody's interested.
So that gets you tells you how to get set up with them. And that's the only changes to the vision plan for next year. The one thing for anybody who's signing up new, remember, you do not get an ID card on the vision. It is your social security number that's the ID. So if somebody is going to get glasses or contacts without you, please make sure they know the last 4 of your social, because they will need to verify that in order to get the benefits. VSP is a live time transmission. So when they're building your glasses, they're doing it right in the VSP website, and it's going to take all of your discounts based upon your social security number. So if they don't know that, they're going to get the full price, and then you'll have to submit a claim to get reimbursed afterwards for the VSP plan. The VSP plan is not the plan that you sign up for an eye exam. If you are enrolled in either one of the 2 medical plans, your eye exam is covered under the medical plan. And because the medical plan is bound by the Affordable Care Act, the medical plan covers your eye exam for free. The Well Vision eye exam under medical is $0 to you. If you use the VSP plan, they're going to charge you a $15 copay, and I cannot override that. The VSP plan is not bound by the Affordable Care Act, so the $15 copay will apply. You have to do the bullying, and if you are using a vendor for your eye exam that's also an Anthem provider and the VSP for the glasses, you got to make sure you bully them to breaking out that claim. The exam goes to Anthem. The glasses or the contacts goes to VSP.
Can I just add to that, or like ask if this makes sense then? My son just got glasses a few weeks ago, and I was confused as why his exam was covered, but then when we went to go get the glasses at the same place, they didn't accept the VSP.
Probably because they were an Anthem provider, but not a VSP provider.
Okay.
So you
right.
have to take the prescription to a VSP vendor and have them fill the eyeglasses.
Which was, we couldn't find anyone, so we had to pay partial. Ended up having to go to New Hampshire, and I could not find, I guess at the time I couldn't find a place open who could get us in order to get him his glasses. And we paid, I believe it was half of the allowance for the frames and the lenses.
Did you go to an out-of-network provider?
Yeah, we couldn't find one in network. I had a hard, so that was a question for Janine, if you had a list of local in-network providers, because I really struggled online trying to find that.
Yeah, right on the VSP website, they have a provider directory. I do know, excuse me, I use Associated Eye Care in Sanford. They also have a location in Waterboro, and there I'm able to have my eye exam under my medical, and I go next door to their hardware store, and I was able to get my glasses and apply my VSP.
Okay, so that's where we went. And so is it because I didn't know I had VSP that they said they couldn't look it up with my Anthem card, and I didn't know it was called VSP.
Yeah,
So that's why.
Anthem is not the provider for the vision, so that's VSP, and your ID card is your social security number.
Yeah, I didn't know that when we went to the exam. I figured that out a few days later when we were trying to find, and by that time they were closed, and that poor boy's been blind for 2 years. So, but it was
Did you
affordable.
already submit the claim?
What do you mean?
So you said you paid because the vision plan out of network only gives you $70 towards the frames.
Correct.
But you were using the same provider as Janine, who we know is an in-network provider?
No, we ended up going somewhere else to purchase.
Oh,
his
okay.
frames. Yeah.
Okay.
Yeah.
So yeah, if you are using an in-network provider, it would have done online.
Right.
But not with your Anthem card, because
Right,
your
and
Anthem card has nothing to do with that.
Right. And
So
I
have you
didn't-
already submitted the claim to VSP for reimbursement, or did they just know what to charge you?
They charged me, I have a receipt. I don't know.
Okay.
Like it was a partial. Yes, it was. I wasn't charged full price
Okay.
for them. So it was partial off of both. But again, I didn't know about the frames only, you said every other year to replace them.
Correct.
So with him being 14, we paid that extra like $12 to get their insurance through. It was Lens Crafters down in New Hampshire. And
Oh,
so,
yeah, they are not in the network.
yeah,
Yeah.
but, okay,
So if you submitted the claim, or I don't know how it worked, if they gave you the 70%, the $70 off,
mhm,
they must have known what was out of network. I
mhm.
don't know if they submitted the claim on your behalf, because if you just bought them and they just gave you the credit for being nice guys, VSP doesn't know you got frames in 2021, and you'd be eligible for frames again in 2022. But if you submitted the claim, or they submitted the claim as an out-of-network provider, it doesn't matter that you got the frames at the out-of-network. You would not be eligible again until 23.
Okay, yeah, okay.
Okay. So any other questions about any of your benefits? Because that's really all I had for you for 2022. So now's the chance to ask me any questions that you may have. No, not seeing anything come up yet. Nothing?
I have a question. Is
Yes.
the life insurance only if you have health insurance?
No, because there are 63 of you enrolled in what we call Life No Med. So I don't know who pays that, but you are probably enrolled. I'm assuming that the community, that your county pays for that.
Yes, the agency pays the life insurance cost monthly for anybody that is not enrolled in a medical plan. So it's what we consider, what Debbie just said, life no medical. So that is still completely free to you.
So you should all
Thanks,
have the
Bob.
coverage. And if you need to know who your beneficiaries are, you can call the Health Trust Member Service Team, or you can just fill out a life change form, and that will take care of it for you. Any prescription money saving tips? No, other than if you are getting a 90-day supply of a prescription, and it's something what we call a maintenance medication, you can use the mail order. The mail order will save you 1 copay every 3 months, because we only charge you 2 copays through the mail order, but you're getting a 3-month supply. If you're getting a 3-month supply at a local pharmacy, which you can do, but you're going to get charged the 3 copays. So you only save 4 copays a year on your prescriptions if you use the mail order. Other than that, there's really no other saving tips other than generic, but you're bound by that under Maine law anyway. The pharmacies have to give you a generic in place of a brand name unless you specify, or your doctor specifically specifies, that you get the brand name only. And then you're paying the higher copay. Yeah, you're welcome. There is a document on my webpage that talks about getting started with mail order. And it's, it's a process. You got to get new prescriptions. You got to send them into Ingenio, get yourself in the system, get your ID card set up. But once you get going in the system, it's pretty easy, because Ingenio will actually even reach out to your doctor if you have no refills left. So it's just getting that initial setup that can be a nightmare. And that's why it's also a very good idea to have a local pharmacy have a prescription on hand as well for at least a 30-day supply, in case anything happens with mail order and it doesn't get to you in time. You can go fill it at your local pharmacy for at least a 30-day supply and not go without your medication. Janine, remind me, do you guys have a flexible spending account?
We do, healthcare and dependent care.
Okay, and is that through Group Dynamic as well?
That's through Health Equity.
Health Equity, okay. So if you have a debit card under your flexible spending, you can use your debit card with the mail order. But remember, with flexible spending, you have to have the full amount on that debit card in order for them to process it. But they will take the debit card as your payment method through the mail order if you would like to. Any other questions for me about your benefits? Okay, that's really all I had for this meeting. Not a whole lot of changes for next year, so hopefully it's a smooth and simple open enrollment for you.
Thank you.
Okay. Everybody have a great holiday. And hopefully I get to see you all next year in person.
Thank you.
Thank you, Debbie.
Thank
You're
you.
welcome.
Thank you.